Evening, everyone. Yes, myself, Dr. Sanjay Khatri. We are here. NEET PG 2023 Pediatric Extra Edge MCQ Part 4. Yes, this is a series, some extra edge MCQ which keep you ahead of others. Yes, something about Unacademy that is today, Friday, 26th August. Take Unacademy and get 20% discount offer and very soon. Now this is the thing which I want to give more attention. NEET PG 2023 integrated and system wise batch. So there are few topics which you need insight of two educators: biochemistry pediatrics, microbiology pediatrics, medicine radiology, orthopedics anatomy. Two things. So two educator of their subjects for a particular topic, something new. You will definitely enjoy this batch. So enrolled in this batch start 25th August. So yeah, total duration is 5 months. Slowly we will move in this and you will be definitely benefited with this. Now, question bank. Unacademy team working so long on this question bank. Finally, they make it. So this question bank on Unacademy Plus student. So what you are waiting for? Go for this question bank. Now, we have done one YouTube session yesterday, then special class yesterday, then morning to today morning. So one special class. Today is the YouTube session. In this series, it is part 4. And after this class, after 25 minutes, again at 8:30, we have a special class. Yes, we are here. Extra edge MCQ. Some MCQ which require to be know and they are very important, which provide your study a extra edge ahead of others because you are attending this session. Answer this question. Answer this question. 18-year boy brought to emergency because 2 days history of high grade fever. Fever with chills and rigor. Fever with chills and rigor. Can it be malaria? Can it be filaria? It can be UTI. It can be tonsillitis. It can be any abscess anywhere in the body because fever with chills and rigor. 2 days, chills and rigor. Malaria, filaria, UTI, tonsillitis, any abscess in the body. Now, complain of shortness of breath. History of IV drug abuse is there. Physical examination revealed new systolic murmur. This statement killed the question. So these all causes are now not applicable. Chills and rigor with new murmur, it is infective endocarditis, i.e. murmur with fever with chills and rigor, best heard over left sternal border. The patient has no prior history of cardiac disease or surgery. Which of the following? Yes, to prove endocarditis, we need to detect organism in the culture. There are Duke's criteria. I am not going in that detail, but yeah, when you make the diagnosis of endocarditis, one major criteria is blood culture positive. So our question, patient blood culture isolate what? See, I want answer from your side. Anybody wants to put answer in this? What you are expecting with this background of history? What should be grow in? Blood. What should be grow in? Blood. Yes, Diksha put it B. Let's see. Infective endocarditis is, it can be acute, which occur in native heart wall. Native heart wall. No prior history of heart disease. Native heart wall. And it is caused by staph aureus. Subacute. It occur in already damaged heart wall. Patient is having mitral stenosis, MR, AR, bicuspid aortic valve, on which endocarditis occur. That is subacute. It is caused by Streptococcus viridans. Prosthetic, if it is occur within 2 months or it occur from 2 months to 2 year. So if it occur within 2 months, so most common organism causes prosthetic wall infective endocarditis is staph epidermidis. And if occur after 2 months to 1 year, 2 months to 1 year, then it is Streptococcus viridans. So in drug abuse, again it is Staph aureus, and most common wall involved in drug abuse is tricuspid wall. With this background, we will read the question again. Question says, no prior history of cardiac disease or surgery, means it is a native heart valve. Then history of IV drug abusers, which is commonly involve tricuspid wall. And also when tricuspid wall involve IV drug abuser, then again it's Staphylococcus aureus. Murmur best heard at lower sternal border. It's a murmur of tricuspid regurgitation. So all points suggestive causative organism has to be Staph aureus. So I hope no confusion in this. Most common causative organism in this Staph aureus. With this background, when you send the blood for culture, you expect Staph should be grow. Staph aureus. If it's a prosthetic wall, Staph epidermidis. If it's a already damaged wall, if patient previous history of mitral valve surgery, patient is having AR, then Streptococcus viridans. So it's very clear history, which organism, which is the causative organism is here for you. Staph aureus, native wall, no history of cardiac disease, no history of cardiac surgery, drug abuser, tricuspid wall involved, drug abuser again, Staph aureus is there. So am I clear with this answer? Staphylococcus aureus. Answer this question. I am waiting for your answer. Something new. Yes, this type of question may occur and we never concentrate on this topic. A breastfeeding mother, a lactating mother, which drug she should not take? So spend some 15 seconds. I will wait for your answer. Let's try. Amiodarone, antiarrhythmic, anxiolytic, clonazepine, acyclovir, retroviral or antiviral drug, morphine, you all know. So I am getting answer A. Yes, answer is A. Amiodarone, mother should not take, who is lactating mother. So this is the list given in the reference journal. Amiodarone should be avoided. Anti-neoplastic drug, mother should not take any anti-neoplastic drug, or if she is on anti-neoplastic drug, avoid breastfeeding. Gold salt, mercury should not be taken by mother. Gold salt should not be taken. Iodine, mother should not take iodine high doses. Lithium, mother should not on mood stabilizer. Lithium should not take. Radiopharmaceutical and retinoids oral. So these are absolute contraindicated drug. You can remember anti-neoplastic, amiodarone, gold salt, iodine, lithium. This is first class. This drug should not be given. Yes, mother can take acyclovir. We give to the mother if develop chicken pox. Morphine, yes, we give. Generally, anxiolytic have mild sedation. Avoided during breastfeeding because some amount of drug should go in breastfeed. So baby may feel little drowsy, but olanzapine is the safest can be prescribed olanzapine and quetiapine, categorized as acceptable for breastfeeding. Mother have some psychiatric symptoms, mother have some anxiety, so you need to calm down the mother. So which angiolytic safe in lactating mother? This is the extra edge for question. Olanzapine and quetiapine safe in lactating mother, and you should avoid amiodarone. Amiodarone, yes, postpartum psychosis hota hai. That's why it's very essential you should know angiolytic, which are the safe angiolytic mother can take. Yes. So, mother, if take lithium during pregnancy, I am not telling the breastfeed. If during pregnancy, abstain anomaly of heart occur. If mother is a known case of SLE, congenital heart block, mother will have anti-Rho and anti-La antibody positive. Mother is having mumps, baby will have endomyocardial fibroelastosis, EMF, endomyocardial fibroelastosis. Carbimazole, methimazole. If mother is taking these drugs, aplasia cutis congenita occur in the baby. Which syndrome associated with aplasia cutis congenita? It's trisomy 13 or Patau syndrome. Erythromycin, if mother take erythromycin, pyloric stenosis occur in the baby. If mother taking sodium valproate during pregnancy, neural tube defect. These all are universal question. But sometimes we avoid drug taken by mother during breastfeeding. These to be avoided, and this is one of those questions. Mother should avoid amiodarone if she breastfeed the baby. Answer this question. Yes, Chesta and Manali, your both answer is correct. Anybody put name in the comment box what this disease is. What this disease is. No. Dr. Jain, it's not group A streptococcus. The key point, chest radiograph shows multiple nodules. This is the key point. No, it's not acute rheumatic fever. See what happened. A child is having sore throat. This is the heart. From here, pulmonary artery taking blood to the lung. Here it is SVC, IJV open into this via SVC. Now, because of sore throat, in some cases, there is thrombophlebitis of IJV occur. Internal jugular vein thrombophlebitis. It produce little bit thrombotic element here. So this microthrombus IJV come to SVC, then come to RA, RV and goes to lung. These microthrombus, and when we see the X-ray, these thrombus produce multiple nodules. A child with sore throat history, X-ray show multiple nodules. My friend, this is Lemierre disease. Lemierre disease, and it's caused by Fusobacterium necrophorum. Fusobacterium necrophorum. This question comes last year in MLE exams. So MLE, this type of questions are coming. Yes, it is given in Nelson. Fusobacterium necrophorum leads to Lemierre's disease, and it is sore throat, thrombophlebitis of IJV, microthrombus reaches to lungs, which produce multiple nodules in the lungs, Am I clear? Am I clear? Lemierre disease, Fusobacterium necrophorum, thrombophlebitis of IJV. Why? Because of sore throat, multiple nodules in the lung. This is the purpose of extra H. You listen this question, you attend this session, this question is with you. So you will never forget sore throat, multiple nodules in the lung, Lemierre disease. You will never forget. Answer this question. I wait for 15 seconds. Let's see. So, anybody wants to answer this? Good. Indian. Let's see. So, distal renal tubular acidosis. Normally, what happen? Normally, H ion excrete here. H ion excrete in distal tubule. What happen in distal renal tubular acidosis? There is block in the excretion of H ion. This is point number 1. There is a block in the excretion of H ion. When H ion is not comes in urine, so urinary pH is more than 5.8. Due to unknown mechanism, distal renal tubular acidosis associated with hypercalciuria, and number 4, nephrolithiasis or renal stone. So these are the 4 points. Distal renal tubular acidosis. 4 points. Distal renal tubular acidosis. Block in excretion of H ion. Urinary pH more than 5.8. Hypercalciuria. Nephrolithiasis or renal stone. Come to the question. When reading the question in the last line, they have already mentioned that it is distal renal tubular acidosis. So what do you expect in the kidney? Just we learn nephrolithiasis, nephrocalcinosis, renal stones. Renal stone will be there if it's a distal renal tubular acidosis. Am I clear? Clear? Sometime question is big, history based, and you lost in the question, but the keyword is last line. Then this question is very easy. If you know it's distal renal tubular acidosis, so distal renal tubular acidosis will have nephrolithiasis or renal stone. Read this question. Yeah, it's that spell. That spell. If child more blue while crying, it is cyanotic spell. It is cyanotic spell. When child is cyanotic spell, he presumably is take a posture, take a position that is squatting position. So you may be wonder how squatting will help. Now see. This is LV. This is RV. From RV, pulmonary artery arise. Top, what is there? RVOTO, RVOT obstruction. Now see, aorta is overriding. There is a VSD and there is RVH. These are the four component of top. RVOTO, VSD, overriding aorta, and RVH. Four component of top. Now listen. Pure blood from LV goes to body. Impure blood in RV has two exits. This blood supposed to go in the lung, but there is an obstruction. So most of the impure blood through overriding aorta goes into body. So body receive mixed blood. That's why there is cyanosis in the body. What happen if child, suppose RV have 100 ml of blood, 30 will go this side, 70 will go this side. Now if child cry, what happen? If child cry, this RVOT get spasm, more narrow. Instead of 30, 10 ml blood goes to the lung. So 90 goes to the body. More impure blood goes to the body. So cyanosis increase when child is cry. Cyanosis increase when child is cry. Why? With the cyanosis, there is a spasm of RVOT and decrease in systemic vascular resistance. Crying is like exercise. Suppose I tell you, go and run 500-meter fast. Then what happened? Your face is flushed because peripheral vasodilatation occur. Same occur during crying. Now, how squatting help? Now, concentrate. When child squat, there is a compression of femoral artery. Now, presume this is femoral artery. So, this will compress. Femoral artery compress. When femoral artery compress, then what happen? Pressure here is high pressure. So blood from RV faces a resistance to go upward. Blood from RV faces a resistance to go upward because of squatting, pressure is high. Then automatically more blood goes into lung. Suppose 100 ml blood is there, previously 90 going to body and only 10 going to lung. When child is squat, pressure here increase. So instead of 90, 40, 50 will go there and more blood goes to the lung. More impure blood goes to the lung. More oxygenation occur. Child feel relieved when child is squat. Squatting causes femoral compression, femoral artery compression, which increase systemic vascular resistance. So blood from RV face resistance to go into aorta and more blood goes to the lung. So saturation will improve with squatting. So saturation will improve with squatting. So hope I am clear in this. Clear in this. Which position child assume frequently? Squatting. And how squatting help in abortion of cyanotic spell? Because it decrease the amount of blood which from RV going to aorta and increase the amount of blood which from RV goes to the lung. Clear? Clear? Answer this question. I will wait for 30 seconds. Even more, I want you should give the correct answer. I am waiting for your response. Yes, Darshita, Lakshmi, Fayaz, Manali, Dr. Jain. Okay. Rameshwar, Ritu, Fayaz. Okay. Now, we are teaching since so many years, so many years, so many years. If baby is meconium stained and dull, poor respiratory effort, do not do mouth, nose suctioning, do not do tactile stimulation. If you do anything like this, it will make baby cry. If baby is meconium stained, quickly do the tracheal suction. These were old guideline. If baby is meconium stained, poor respiratory effort, do not do initial step. What are the initial step? Positioning, clearing of mouth, nose, tactile stimulation. Do not do this directly. Do the laryngoscopy and do the tracheal suction. This was old concept and we taught this so many years, so many years, so many years. Now, new NRP guideline says, new NRP guideline says, if baby is meconium stained with poor respiratory effort, no need for tracheal suctioning. No tracheal suctioning. You just do initial step. This is landmark question in resuscitation. You got it, na? You got it? No need for tracheal suctioning. Do initial step first. Do initial step first. Do initial step first. Yes, only few put it right. Baby meconium stained, poor respiratory effort. So we position the baby, clear, extend the neck, clear the mouth, nose. That is known as initial step. So yes, no change in the resuscitation guideline. We always perform initial step first. In this also, we need to do initial step of neonatal resuscitation. Am I clear? No role of tracheal suctioning. No role of tracheal suctioning. Clear? Do initial step in meconium stained baby. Answer this. Something new milestone, extra edge milestone. This type of question, milestone questions are so frequently they ask in UPSC. They ask in UPSC. So when child unscrew a lid, 2 year. Turning a doorknob, 2 year. Now see, 2 year milestone, 2 year fine motor milestone. What are the 2 year fine motor milestone? Child can draw vertical stroke, tower of 6 cube and turn one page of a book at a time. Means child can do turn one page of a book at a time. 2 year this milestone develop. See my finger. This milestone develop. This 2-year-old child turning a doorknob. 2-year-old child, unscrew a lid. Unscrew a lid. 2-year-old child, turn one page of a book at a time. So yes, this is a milestone of 2-year-old child. This is a milestone of 2-year-old child. Vertical tower of 6 block is a 2-year-old child. Circle, a 3-year-old child can make. Sometime these milestones we need to remember. Common we remember, but these two concentrate for today's class. Unscrewing a lid, turning a doorknob, 2 year of age. So yes, these all are extra edge questions. Whether it's a breastfeeding mother, or it's Lemierre disease, or it's an infective endocarditis, or I can say meconium stain baby resuscitation, these all carrying a meaning. These are extra age question. So yes, we have done with our 4 session. 4 session we have done. Last one, special class on Unacademy app, just 25 minutes from now, 8:30 p.m. Again, some good, some crack 7-8 question for you. Those are extra edge questions. If you miss the first yesterday session, you can again watch this on YouTube. Yes, so these are extra edge series. The 4 series, 4 session we have done. Last session 8:30 to 9 p.m. So yes, myself Dr. Sanjay Khatri. Keep reading. Let's crack it. I try my level best to give you some extra as question which provide you something in just 20-25 minutes to think, to recapitulate all the things, to memorize all the things. That's it. If you like it, you share in your group. Keep reading. Let's crack it. Thank you. God bless you all.